The beauty of CCIH is that it's a tapestry, right? It brings together so many different organizations working in radically different contexts, but are struggling with the same challenges. So whether you're a small rural clinic or you're a large NGO, a global NGO, or an academic institution, when we're all together at the same table, we see the gaps, we see the blind spots. So maybe a small organization has discovered a low-cost approach to solving something that a bigger organization hasn't. Or maybe that bigger organization has access to infrastructure or a global platform that that small organization doesn't have. So when funding gets tight, it's this shared learning that's not just useful, but very life-saving, because it's very practical. We just learn faster together.
I think faith-based actors, Christian organizations, should get involved with CCIH because we're entering an era in which cooperation, collaboration, pooling of talents and of opportunities is more and more important. It used to be in the past that you could, as one organization, get a grant from a donor. That's less and less true now. So it requires organizations with a mix of skills, a mix of community bases, a mix of different opportunities to come together and to work with much larger organizations like the multilateral development banks. Some programs are best suited to small community-based organizations. Some require much larger regional or national organizations which can put forward multi-million-dollar programs at scale. So having a mix of those enables a group like CCIH to respond to every opportunity.
Involvement in CCIH has really helped our work when we actually joined CCIH during COVID. So it seems like I've been with CCIH forever, but I have to say of all the networks we joined, CCIH is probably my favorite. I think that we have gotten small grants from CCIH to help in some of our programs around accessible health systems. We've also been able to meet other people that we've been able to develop partnerships with, because our model is to work with other organizations to help them with disability inclusion. We've been able to do that, as well as been able to talk about our work in forums. Like I just did a pre-conference workshop with a bunch of NGOs that are really interested in how can we be more disability inclusive in the organizations that they're working in. And we also learn a lot from CCIH too. I appreciate just how CCIH is keeping up on what's happening even with government funding, with other potential funders, and also just like what's the latest in terms of what we should be doing when it comes to global healthcare and initiatives. And so we love CCIH.
I am really excited to be part of an organization that is really rooted in the moral core to take care of our neighbors as we would take care of ourselves and our families, but also to offer this space where other faith-based organizations, in this case Christian organizations, can come fully into the space without feeling like they don't belong. The convening role that CCIH offers is really important, and I don't think there's any organization as CCIH that can replace that.
Yeah, I think one of the great insights and benefits was the whole networking piece of coming to the CCIH conference and really meeting people from all around the world with a similar mission and focus on serving God through their work. And so that has really expanded my point of view on what God is doing. And so it's exciting to network and partner with folks and think about where we're going to go with this in terms of training health workers in learning how to share the gospel, learning how to be the hands and feet and mouth of Christ is very exciting.
Ron, and for me, nothing is more fulfilling than being where God wants you to be, when He wants you to be. And we really feel like we've hit the sweet spot on that right now.
Yes.
Come to think of CCIH as a platform for sharing insights and partnering with agencies in developing countries. I think the element of partnership is most important to our organization, IMRES. We have a mandate to provide affordable healthcare products into lower and middle income countries. But we cannot do that on our own, obviously. So we need partnerships, implementing agencies who actually make that happen. CCIH is a great platform to strike new partnerships, to maintain existing relations, and that's what has been most valuable for us, for IMRES, in all these years attending CCIH.